Do you frequently feel like your heart pains sometimes? Or maybe you suddenly get a high fever, your eyes turn yellow, and you feel too weak to get out of bed. Imagine coming back from a trip to a forest or a place with lots of mosquitoes and suddenly feeling very sick, like your body is on fire. That might not just be a bad flu. It could be yellow fever. This disease is called yellow because some people's skin and eyes turn yellow when they're affected. It's rare but serious, and it mostly spreads in tropical parts of Africa and South America. Have you or someone you know ever traveled to these areas and felt very ill afterward? Then yellow fever could be the hidden reason. So what actually causes yellow fever? Think of it like a tiny invader that rides into your body through a mosquito bite. That invader is a virus, the yellow fever virus. It's not spread by coughing or touching, like colds. No, this one comes from a specific type of mosquito, mostly the Aedes aegypti, the same mosquito that spreads dengue. These mosquitoes love warm, wet places, like rainforests or cities with standing water in old tires or pots. When an infected mosquito bites you, it passes the virus into your blood. Then the virus starts multiplying, attacking your liver, kidneys, and other organs. It's like a hacker entering your computer through a weak connection. Once in, it starts damaging key parts. So, if you're in a jungle or an area with lots of mosquitoes and no clean water systems, you're at higher risk. Ever seen those loud, buzzing mosquitoes at dusk? That could be your warning sign. Now let's play detective. If someone has yellow fever, what clues would you see? First, sudden high fever, like your body is running a heat wave. Then chills, headache, and severe muscle pain. Imagine feeling like you've run a marathon with no training. Some people also lose their appetite or vomit maybe. Even black vomit, a scary sign of internal bleeding. After a few days, most people start to feel better, but for some it gets worse. Their eyes and skin turn yellow. This is called jaundice, like a ripe lemon. Some bleed from the gums or nose, and their kidneys start failing. It's like the body's factory shuts down because the main worker, the liver, is too sick to work. So ask yourself, would you ignore a fever and yellow eyes after a mosquito-heavy trip, or would you rush to a doctor? How do doctors find out if it's yellow fever? They can't just guess. They ask, where have you traveled? Have you been bitten by mosquitoes? Then they take blood tests to catch the virus or check for antibodies, your body's soldiers fighting the invader. There's no magic pill to kill the yellow fever virus directly. So treatment is about helping your body survive the attack, like giving fluids through a drip, controlling fever, and helping you rest. If bleeding happens, you might need blood transfusions. It's like giving your body extra backup when it's losing the battle. But here's the key: the earlier you go to a doctor, the better your chances. Waiting could be dangerous, like trying to fix a broken engine after the car has already crashed. The good news, you can protect yourself, and it's easier than you think. The best shield is the yellow fever vaccine. One shot, and you're protected for life in most cases. It's like wearing an invisible armor against the virus. Many countries require this vaccine if you're coming from or going to high-risk areas. Also, avoid mosquito bites. Wear long clothes, use mosquito repellent, sleep under bed nets, and remove standing water around homes. Think of it like locking your doors at night. Simple, but it keeps danger out. So before your next jungle trek or tropical holiday, did you check if you need the yellow fever shot? Science is always moving. Recently, researchers are working on better and cheaper vaccines, so more people in remote areas can get protected. There's also new research on how the virus spreads among monkeys and mosquitoes in forests, helping to predict outbreaks early. Some scientists are even testing new antiviral drugs that could one day treat yellow fever directly, not just manage symptoms. Imagine a future where a simple pill stops the virus cold, like turning off a switch. And mobile labs in villages can now test for yellow fever in hours, not days. That means faster help. So, even though yellow fever is old, Science is fighting it with new tools every day.